The truth about filler migration, what you need to know. Filler migration is rare and usually due to technique. Properly placed dermal fillers generally stay where they're injected. Filler migration is rare when done by a skilled injector. It tends to occur when too much filler is used or when improper technique is applied. A study in the Journal of Clinical and Aesthetic Dermatology found that dermal fillers have a low risk of migration when injected correctly into the appropriate anatomical layer. Issues like migration typically stem from poor technique or placement in highly mobile areas like the lips. Hyaluronic acid fillers naturally break down. The most common dermal fillers are hyaluronic acid based, which is a naturally occurring substance in the skin. These fillers are biodegradable and break down over time, reducing the likelihood of long-term migration. Research published in Dermatologic Surgery in 2014 explains that hyaluronic acid fillers are broken down by the body's enzymes, and the risk of long-term filler migration is low because they dissolve naturally over 6 to 12 months. Overfilling can also lead to filler migration. Overinjection of fillers in one session increases the risk of migration because the tissue cannot hold that much volume, especially in mobile areas like lips. According to a review in Plastic and Reconstructive Surgery, overfilling can lead to excessive pressure in the tissue, causing filler to shift away from the intended area, particularly in areas of high movement such as the perioral region. Technique and placement are key factors. The injector's skill and knowledge of anatomy are the most critical factors in preventing migration. Deep placement in the right layer of tissue is essential to avoid complications like migration. A study in the Journal of Drugs and Dermatology highlights that precise placement in the subdermal or supraperiosteal layer, depending on the area treated, is critical to minimize risks, such as migration. Movement in highly mobile areas can contribute to minor shiz. In areas that experience a lot of movement, like the lips, there is a higher risk of filler moving slightly due to mechanical forces. However, significant migration is uncommon. A 2020 article in Aesthetic Journal, Surgery Journal, states that while minor filler shiz can occur due to muscle movement, substantial migration is rare if the filler is placed correctly and not overfilled. Correcting filler migration with hyaluronidase. If filler migration does occur, it can be reversed using an enzyme called hyaluronidase, which breaks down hyaluronic acid fillers quickly and safely. According to a study published in Plastic and Aesthetic Research in 2019, hyaluronidase is highly effective at dissolving hyaluronic acid fillers, providing a safe solution for correcting filler migration.